السلام عليكم ورحمة الله وبركاته. طلبتنا الأعزاء، طلبة المرحلة الثالثة، إن شاء الله تكونون بخير وسلامة بهاي الظروف الصعبة اللي يمر بها بلدنا. اليوم المحاضرة مالتنا ضمن موديول Health and Disease in Society S5. راح نتكلم اليوم على Sociological approaches to chronic illnesses. Learning outcomes. By the end of this lecture, the student should be able to first describe the sociological research on how chronic illness and or disability impacts on the people's life and identity. Second, explain what is meant by stigma. Third, explain different concepts of impairment, disability, and handicap. So, we start by classification of diseases. Generally, the diseases are classified into acute diseases and chronic diseases. The acute diseases are illnesses that strike suddenly, and cause dramatic incapacitations and sometimes even death. The acute diseases characterized by short duration, and the typical example is, for example, acute appendicitis. Chronic diseases are long-term or lifelong illnesses. Long-term or lifelong illnesses that develop gradually or are present at birth. The treatment of chronic disease is typically more costly due to longer duration of this problem. For example, DM, hypertension, and myocardial infarction. Chronic diseases. It includes wide range of conditions that are, first, long-term. Second, has a profound influence on lives of the patients. And third, some fatal and some are not. The chronic diseases includes communicable diseases. Communicable, it means person to person transmission, or any form of transmission. So communicable, it means infectious diseases that are transmitted either from person to person or any form of other transmission. And these include, for example, tuberculosis, leprosy, acquired immune deficiency syndrome, AIDS, and others. All of these infectious diseases are chronic diseases. Non-communicable diseases, also these could be other forms of chronic diseases. Non-communicable diseases include, for example, ischemic heart disease, hypertension, diabetes mellitus, carcinoma, chronic mental illnesses, rheumatoid arthritis, and others, for example, cardiovascular accident or stroke. All of these represent chronic, non-communicable diseases. It means there is no transmission. And then a question, why TB incidence and mortality increasing? TB مثل ما قلنا, it is one form of the communicable chronic diseases, and its incidence and mortality are increasing nowadays. So why? First is poor strategic plans. Second, the presence of HIV and AIDS, which suppress the immunity. Third, the emergence of multi-drug resistant TB strains. Fourth, poverty, الفقر. Fifth, war and immigration, الحروب والهجرة. Sixth is the no effective vaccination available. And finally, no new drugs. All of these factors working together in increasing TB incidence and mortality. The characteristic of chronic illnesses, they are first permanent, they will leave a residual disability caused by non-reversible pathology. They require the special training of the patient for rehabilitation, and they require long period of supervision, observation, or care. So, the burden of chronic illnesses is caused by these factors. That is, the disease is permanent. It usually leaves a residual disability. It is caused by non-reversible pathology. It required special training of the patient for rehabilitation and required long period of supervision, observation, or care. Problems in the etiological investigation of chronic non-communicable illness. Problems in the etiological investigation of chronic non-communicable illness. First is the absence of a known agent. Second, multi-factor nature of etiology. Third, long latent period. And finally, indefinite onset. All of these, طلبتنا الأعزاء, represent a problematic in the etiological investigation. Indefinite onset, يعني there is no definite time for the onset of the illness. A long latent period, the patient, for example, may have hypertension for a long time before the discovery of the disease. Multi-factor nature of the etiology, for example, hypertension, it has many causes. For example, obesity, increasing age, atherosclerosis, etc., renal disease. So there is multi-factor nature of etiology and absence of a known agent. Sometimes there is no any etiology for hypertension. All of these represent problems in the etiological investigation of a chronic non-communicable illness. اكو مصطلح شباب اسمه الابيديميولوجيكال شيفتنج. epidemiological shifting. What is meant by epidemiological shifting? It is the general shift, ركزوا وياي, from acute infectious and nutritional deficiency diseases characteristic of underdevelopment to chronic illness characteristic of modernization and advanced level of development. يعني there is a shift in the epidemiology from acute infectious and nutritional deficiency diseases to chronic illness, which is characteristic of modernization and advanced level of development. Why؟ نانا راح نجاوب على causes of epidemiological shift in the next few slides. So why there is epidemiological shifting? First, demographic changes. Decrease in infertility rate. هذا معناها الfertility increased. إذن decrease in infertility rate. النقطة الثانية decrease in infant mortality rate. Both these will lead to population aging. يعني عندنا more population reaching the adult life. A second cause for epidemiological shifting is urbanization and socio-economic transformation. Changes in community relationship, changes in lifestyle, decrease concerns about moral beliefs, human mobility, expansion of education, participation of women in labor force. All of these causes epidemiological shifting due to urbanization and socio-economic transformation, due to changes in community relationship, for example, changes in lifestyle, decreased concerns about moral beliefs, human mobility, expansion of education, participation of women in labor force. النقطة الثالثة بالepidemiological shifting، الكوز الثالث هو changes in a nutritional pattern. These are rapid increase in food energy availability and consumption, where per capita food energy and protein availability had increased by two-folds. per capita تعنينا حصة الفرد الواحد. إذن السبب الثالث بالepidemiological shifting هو changes in nutritional pattern. أولا إنه there is rapid increase in food energy availability and consumption, where per capita food energy and protein availability has increased by two-folds. The availability, for example, is the availability of rice increased by five-fold, wheat increased by eight-fold, sugar increased by three-folds, fat increased by three-folds, whereas there is no increase in vegetables and slight increase in fruits. For all of these cause epidemiological shifting. الكوز الرابع هو limitation of medical treatment. إنه due to many conditions can only be managed or treated palliatively, not cured. وبالتالي راح يكون عندي more chronic illnesses. And 5 هو other causes. الكويستشن بهذا السلايد طلبتنا الاعزاء انه why we study chronic illnesses. Why we study chronic illnesses? First, because impact of chronic illness and disability on daily life is necessary for providers of medical and social services to offer appropriate care and support. Second, emotional responses to chronic illnesses, example, anxiety and depression, and possible effect of stress on health outcomes. All of these make us studying chronic illnesses. So, what are the impacts of chronic illnesses? Impact on the patient. Illness can lead to changes of patient lifestyle, body image, self-concept, and loss of autonomy. So the impact of the patient, impact of chronic illness on the patient's illness can lead to changes of patient's lifestyle, body image, self-concept, and loss of autonomy. And these changes vary depending on the nature, severity, duration of the illness, attitude about the illness, and the financial demands and lifestyle changes. Many factors can play a role in a disturbance of self-concept and low self-esteem, such as loss of body parts, financial problems, dependence on the other, unemployment, inability to participate in social functions. All of these factors play a role in the disturbance of self-concept and low self-esteem. Loss of autonomy هو the state of being independent and self-directed without control. Example, crippled or handicapped. And then loss of autonomy is the state of being independent and self-directed without control. Example, crippling or handicap. The second impact of the illness, ورا ما خلصنا impact of the illness on the patient, the impact of the illness on the family. A person's illness affects not only the person who is ill, but also the family and significant others. The impact depends on, first, the number of the family members who are ill. Second, the seriousness and length of the illness. Third, the cultural and social customs of the family, which include increasing demands on time, anxiety about the outcomes, conflict about unaccustomed responsibilities, financial problems, loneliness as a result of separation. إذن مثل ما قلنا إنه impact of the illness on the family، إن مثل ما شرحنا سابقا إنه a person illness affects not only the person who is ill but also his family and significant others. And the impact of the illness on the family is dependent on, first, number of family members who are ill, the seriousness, how serious and how duration of the illness, and the cultural and social customs of the family. The cultural and social custom of the family. And these include, cultural and social customs of the family include increasing demands on time, anxiety about the outcomes of the illness, conflict about the unaccustomed responsibilities، يعني مسؤوليات غير متعود عليها من قبل الفاميلي، financial problems مسائل مالية، loneliness وحدة as a result of separation. Stigma. The stigma by definition is a negatively defined condition behavior conferring deviant status. stigma هي وصمة أو عار مثل ما نسميها بالعربي. هي negatively defined condition behavior conferring deviant status. types of stigma عندنا discreditable concealed اللي هي nothing seen. discreditable concealed اللي هي راح تكون عندنا nothing seen مثل ال HIV positive patient. وعندنا discreditable revealed يعني visible اللي هي physically visible characteristic or well known stigma which set them apart, for example physical disability and some condition بها both revealed and concealed مثل epilepsy. إذن عندي discreditable concealed اللي هي nothing seen for example HIV positive patient. وعندي discreditable revealed اللي هي physically visible characteristic or well known stigma which sets them apart, for example physical disability. Some patients or some conditions, both example patient with epilepsy at the both the concealed element when he is free from the illness and the revealed element when he developed the fit, for example in front of the population or in front of the other family member. He have both the revealed and the concealed types of stigma. Also we have the enacted stigma and the felt stigma. The enacted stigma هو the real experience of prejudice, discrimination and disadvantage as the consequence of a condition, whereas the felt stigma is the fear of the enacted stigma. Also encompasses a feeling of shame which associated with having a condition. Finally, we will talk about the international classification of impairment, disability and handicap. وهذا المختصر مالته. International classification of impairments, disabilities or handicaps. والمختصر مالته هو ICIDH. ICIDH attempted to classify consequences of disease because chronic disorders are disabling in their effects. It offered three concepts. الكونسبت الأول هو impairment. Impairment is concerned with abnormalities in the structure of functioning of body بين قوسين pathology. Then impairment concerned with abnormality in the structure of functioning of the body. Disability concerns with the performance of activities. And then abnormalities in the structure or function of body organs, pathology. Disability concerned with the performance of activities. بينما الhandicap concerned with the broader social and psychological consequences of living with impairment and disability. And then الhandicap concerned with broader social and psychological consequences of living with impairment and disability. And thank you very much.